morning. This was me 2 months ago. I acquired a problem in my left buttock by playing soccer, and I can tell you, dear friends, I was in sheer agony, doing very easy things like climbing stairs or even laying in my bed to fall asleep would turn fast to a nightmare. One evening, it hurt so much, I was at the bottom of a deep pit of despair, and I was thinking I would be crippled for the rest of my life, and I was seeing my future as a very gray and cloudy day. But I knew something. I knew what to do, how to apply and where to apply the right massage to my buttocks, which I've done from the very first moment, and in the afternoon of the fourth day, finally the sun shone again in my life. Toastmaster, dear fellow Toastmasters, I invite you to take a look at this amazing and outstanding concept, which is the trigger point therapy. How so, do you ask? Well, because it is now known that as much as 93% of all clinical pain has probably a trigger point at its origin. And from this amount, as much as 85% has exclusively and the sole source a trigger point. Still not quite known, even in the country where it was depicted the first time, the United States itself. It's something that I hope you will be interested to know more about. So, what is a trigger point? Let us start to assess, first of all, that we have more than 200 pairs of muscles on our body. A trigger point is nothing more than an accumulation of the fibers at the center or at several centers of the muscle that will create a knot that can have the size of a pinhead to the size of a pea that will appear in the palpation as a tender spot. But in fact, it's keeping the muscle stressed, shortened, and sometimes under pain. And now, that's where the trickery and deceptiveness of trigger points start. Because most of the time, they will not send the pain where they are located, but to other places of the body, sometimes far away, and even created the weirdest symptoms. Besides this example, I can give you another one. For example, a pain on your head, on your eye, on your teeth, even tingling ears and the runny nose can be originated by trigger points on your neck muscles. How is a trigger point activated? If we make one or more, or we have one or more of these conditions, we make a too strong a movement, a too fast a movement, we twist the muscle, a contusion on the muscle, repetitive movement, lack of movement also, certain physical conditions, and most of the time a main trigger point will create satellite trigger points. So this deceptiveness of the trigger points, of course, creates many misdiagnoses, use and abuse of painkillers, and unnecessary surgery, just keeping and perpetuating a world, a nightmare, haunted by an evil whose name is pain. So, what can we do, and our beloved ones, to get rid of this trigger point pain? Of course, possessing a book like this, where you have depicted all the muscles, the trigger points, and the referred pain, is of very usefulness. But even if you don't have the book, I can give you a recipe that I guarantee you it will work most of the time. First, start to check out the place where it hurts and find the trigger point pain. Dear fellow Toastmasters, I assure you that you will learn fast and easily how does it feel a trigger point pain. If you find it, massage it several times a day at the point where it hurts the most. Then gradually move away to the muscles on the vicinity and again check again for a trigger point pain. When you find it, again, massage it several times a day at the point where it hurts the most. Of course, it's important to know how to massage it. You must not put your fingers against your muscles without having them protected. Sorry. You must protect the fingers either by using your thumbs together, like this, or your thumb protected with your index, like this, or 8 fingers at a time, like this. You can protect your fingers with your left hand. You can use your knuckles, like this, and protect your knuckles with your left hand. You can also use your elbow and somebody's elbow. You can also use for your leg muscles your knee or your heel, and a rubber ball is also very useful. Of course, there are other tools for auto massaging that are quite effective. Dear fellow Toastmasters, I hope I have triggered on you the curiosity to know more about trigger point therapy, because I can assure you it will keep the sun and the joy glaring on your lives, and sparing you and your beloved ones from hours, months, maybe years.